The Chris Salcedo Show, part of Generation Blaze, only on the Blaze Radio Network.
I want to get to our next guest right now, and I am always on the lookout for alternatives to Obamacare because I believe it's a destructive law, and I believe it's going to ruin our healthcare system. Already is on the way to doing that. Welcoming to the program, Dr. James Pickney II. He's a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center in Los Angeles after graduating from Baylor College of Medicine down in Houston. He's the founder and CEO of Diamond Physicians. It's concierge medical practice focused on the patient-physician relationship. Diamond bypasses cumbersome and inefficient middlemen to deliver personalized, high-quality medical care to its valued clients. Dr. Pickney, welcome to the Chris Salcedo Show.
Oh, thanks for having me on the show.
Your brand of concierge medicine, and you're the first one I've seen marketed like this, bypassing the cumbersome and inefficient middlemen, otherwise known as the insurance companies, otherwise known as, I call them, the traitorous insurance companies who collaborated with the Obama administration to force us to buy their products, not only their products, but a more expensive version of their products. And that's why I'm so glad to hear about your service. Describe it for us, if you will.
Well, our service is simple. We've simplified the process and we've streamlined it. So clients pay a monthly membership fee, and that starts at $45 a month for kids and $95 a month for adults, up to $295 based on age, no pre-medical condition. And that one low monthly fee, you receive unlimited visits. There's no copay, never a copay, 24-hour access to our physicians, 24-hour access to our urgent care facility. You have my cell phone number, my email address, and you are guaranteed access to health care.
Now, what type of technology are you guys utilizing besides the email and the text? Are you guys using any Skype type of technology to maybe see patients who maybe can't get to you or that kind of thing, or is that in the office?
Yeah, we use video conferencing. We have clients from all over the country. Video conferencing is a great medium to translate and do a medical exam if necessary. Sometimes a face-to-face visit is required, but we want to be as efficient as possible. So a lot of times we can do things virtually. For instance, I had a mom who had a 4-year-old, and the 4-year-old gets strep throat every year. Well, she sent me a picture of the back of the throat. I looked at it on my phone. I asked her 4 simple questions. Does your child have a fever? Do they have a cough? Touch their throat? Is it tender? And do they have exudates or, kind of white stuff on the back of the throat? Now, with those 4 questions, I can still practice evidence-based medicine with the center score, and I can tell you with 95% certainty whether or not they have strep throat or not. And even if they do come in and have a negative strep test, I'm still going to treat according to our algorithms. So it doesn't make any sense for them to come in. If they answer these questions appropriately, I write a prescription or I call in a prescription. The mom can go get the script, give the child antibiotics, and save time and money.
The extremist left-wingers in this country are trying to push us into a single-payer system, which will ultimately evolve into what we see in Great Britain and what we see in Canada by and large, which is there will be a segment of the population that can afford quality health care, then the rest of Americans will be relegated to subpar care at government reimbursement rates. I'm just doing some quick math. A family of 5, mom and dad and 3 kids, they're looking at about, just a little under $350 for your service, $320, $330, somewhere around there, for your service per month. That is, for some people, within reach, but for others, you'd probably acknowledge it's not within reach for them.
Yeah, we have a plan for that as well. We are trying to stay away from the 2-tier system. So I agree with everything you just said. Concierge medicine has a stigma. A lot of people feel that concierge is too expensive, and there are doctors out there that charge $10,000, $20,000, $30,000 a year. But we are practicing affordable concierge known as direct medicine. And yes, those price points may be a little too expensive for some families. So we're going to be starting a nonprofit here in the next year called Shine Bright, which will ask for grants and more subsidies so that we can get that price point down to maybe $10 a month for kids and $25 a month for adults. We will get there because we're cutting out so much inefficiency and we're saving so much money that eventually the nation will catch on and say, look, why are we paying insurance companies all this money, these monthly premiums? What are we getting? We're not receiving anything.
Right. No, I get exactly where you're going. And without now, you said grants and subsidies. Are you talking from the federal government? Is that where you get the money from, or would there be a private sector?
There are some federal grants. We're looking for investors as well. And eventually, the system can be self-sufficient. So if you build a clinic, you salary a physician, and you have enough participants in the Shine Bright Clinic, then it can become self-sufficient. But the startup capital is challenging
sure.
To put together something that can serve the entire nation and people from all incomes and income brackets.
And what happens?
Goal.
Yeah, and what happens if your long-term goals are met, Dr. Pickney, when you start seeing more of your clinics springing up and all of a sudden you're getting more market share, you're getting more. So as a normal business would function, as your products get out there and more available, that also drops the price point down as well.
That's exactly right. It creates competition in the marketplace, which is lacking right now.
Sure.
And that's another big driver of cost. When you have no competition, your costs are going to continue to rise. So we are introducing competition back into the market. There's a lot of practices like Diamond across the nation, and there's tons of different models. But our model, again, low monthly fee, and you receive unlimited visits, no copay, and 24-hour access. So you have a doctor on call for you at all times. So we get to spend an hour with our clients instead of the national average, which is 8 minutes. I can't take care of someone in 8 minutes. I can't address any of their problems. I can't do any lifestyle modification. I can't do any nutrition or fitness coaching. That's what medicine is about. It's about changing lifestyle. It's about prevention, and it's about providing an exemplary service at an affordable price.
What a concept. We have a capitalist-based system here that drives excellence. Gee, that's what has driven America's success over these years, and I'm glad to see it's taking hold of the medical field. Dr. James Pickney, he is with Diamond Physicians. Where can folks go if they want to find out more information about your service?
Yeah, please go to diamondphysicians.com. You can follow me on Twitter at @D_Dr. James, and all emails can go to info@diamondphysicians.com. I'd love to hear from you. We'd love to answer your questions. We are a franchise, so we're looking to build Diamond offices all over the country and deliver affordable care to every U.S. citizen.
Another answer to the extremist left-wing policies of Obamacare. Dr. James Pickney, appreciate your time here on the Chris Salcedo Show.
Oh, it's been a pleasure.
All right, more to come. Other side of the break, I see we have some phone calls holding. Stick with me.